I am Danica.
And I am Myra, and this is the Black Women Healing Podcast.
A space to discuss mental wellness.
A space to dive into soul care and vulnerability.
Here, we will support you on your journey as you focus on your healing,
while also giving you the work along the way.
Welcome to Black Women Healing Podcast. Y'all, it's official. We are an Amazon affiliate, and it's only right because our Let's Heal book is offered on Amazon. If you haven't already checked it out, go ahead and click the link in our description and check it out. Help us support you while we support us, while we all support each other, if you know what I'm saying. All right, y'all, check it out. Hey, y'all, we are back with another episode of Black Women Healing Podcast. And as discussed, we're going to really get into health concerns and our medical journeys, especially as Black women in the Black community. And so here we are with another episode. And today we're going to continue the episode about HIV, and we have a special guest, Dr. Michele. And so we really want to make sure we're getting people in here who are doing the research and have their hands in the community. But before we get started introducing her, we're going to start off with a random topic. So randomly, let me think. I'm trying to think what's going on right now that's a good topic.
I'm curious what you've been snacking on since you said you cut out sugar, because when you say you cut out sugar earlier, I instantly wanted a honey bun. So
I've been wanting a honey bun.
I really want a honey bun. So I'm curious what you've been snacking on. What's been your favorite snack?
I guess I really haven't been snacking a lot. I'm a very big like sunflower seeds and chips and all that junk food stuff, but I haven't. I found like these new, or not new, it's new for me. There's like these little Italian shaved ice type of little cups, like frozen cups.
Oh, I love those.
And they're supposed to be like, not as bad. And so I really prefer ice cream, but I'll take that. And so I've been I guess I've been snacking on those. So yeah, but honey bun sounds good.
Have you had the red Italian ice?
Red?
Yeah, they have a red one and a blue one.
No, the one I got, it's just from the local Ralph's, and it is yellow, lemon and strawberry. Those are the flavors.
Those are really good.
Yeah, I don't even really like lemon like that, but it is, it's pretty good. So I won't complain. What about you? I mean, do you smell Dr. Michele? Myra's pregnant. Do you snack a lot?
Congratulations.
Thank you. I'm not a snacking person, but I don't know what it is about being pregnant. I like to eat stuff. So I don't know that it's snacking, but I just be eating. But one thing I find my hand in is a bag of trail mix, especially the ones with the M&Ms. But I figured out that Ralph's is the only one that has like a generic brand where they put enough M&M ratio to the nuts, because most places they just sprinkle a little few M&Ms in there. But this one's good. So
the fact that you know that is hilarious.
Because I love trail mix, but I feel like people don't do a good ratio. But this one is really good.
So trail mix, you'll just kind of snack on that.
All
day. What about you, Dr. Michele?
I like dried fruits. So, I'm trying to cut down artificial sugars as well. But I love me some like organic dried apples and mangoes and stuff like that. And I got this one snack that I liked from the South Beach Diet cookbook. I don't like much from there, honestly, but there's this one where you take ricotta cheese and a little bit of almond extract and some sliced almonds and mix them up. And that's a nice healthy snack. I like that a lot.
Watering.
I know, I'm over here like, okay. Yeah, that sounds delicious. But okay, so as y'all can see, we got our little snacks going on. Before I introduce you, Dr. Michele, how do you pronounce your last name?
It's Andrasik, rhymes with Jurassic, so Andrasik.
Okay. So today, we have a special guest, Dr. Michele Andrasik, pronouns she, her, hers, she is a clinical health psychologist working to build and enhance partnerships with marginalized communities in clinical research with the focus on ongoing vaccine trials for HIV and COVID-19. She is the director of social behavioral sciences and community engagement for the Fred Hutchinson-based HIV Vaccine Trials Network, acronym HVTN, and the COVID-19 Prevention Network, senior staff scientists in the Fred Hutchinson Vaccine and Infectious Disease Division, and an affiliate clinical professor in the departments of global health and occupational and environmental medicine at the University of Washington. Dr. Andrasik received her Ph.D. in clinical health psychology from the University of Miami. She also has master's degrees in health education and psychological counseling from Columbia University. Dr. Andrasik brings expertise in implicit biases and historical trauma and the utilization of community-based participatory research approaches and qualitative research methods. Dr. Michele, oh my goodness. You are out here really, I didn't even know all this, y'all. I'm sorry. I'm reading this myself and I'm just even more amazed because I actually found you. I was just doing like Google searches on who's out here doing the research with Black women HIV. And I had found one of your research articles and that is how I found you. So now reading this, I'm like, oh my goodness.
Well, I'm glad you found me and invited me in. It's good to be here.
Absolutely. I mean, it sounds like we could talk about so much, but today we just want to focus on, HIV. So go ahead and get started. Oftentimes folks get HIV and AIDS confused. So if you could break down the difference between the two, that would be great.
Yeah, sure. So HIV, or Human Immunodeficiency Virus, is a virus. And there are 3 stages of HIV. First off, it weakens a person's immune system by destroying important cells that we use to fight infection and disease. But what we know to be true is that HIV is now a chronic illness because with the proper medical care, HIV can be controlled. And people with HIV who get effective HIV treatment can live long, healthy lives and protect their partners. So the 3 stages of HIV, the first stage is called acute HIV infection. And this is like during the first 2 to 4 weeks after infection, where the person who has been exposed to HIV has large amounts of HIV in their blood. So this period of time makes it more likely for them to transmit the virus to others. And during this time, some people can have flu-like symptoms and some people don't get sick at all. Acute infection is then followed by stage 2, or chronic HIV infection. This is also called asymptomatic HIV or clinical latency, because HIV is still active in our body and it's reproducing all the time at low levels. But generally during this second stage, people don't get sick, they don't have any symptoms, but without taking medication, this period could last a decade or longer, but some people will have a faster progression to HIV. And I think what's really critical is during this phase where people are largely asymptomatic, that lasts for 10 or more years, people can still transmit HIV to other people. Now, at the end of this phase, what happens is the amount of HIV in the blood, or your viral load, goes up, and your CD4 count, which are cells in your immune system, go down, and the person moves into stage 3. Now, people who take HIV medication as prescribed may never move into phase 3. And phase 3 is acquired immunodeficiency syndrome, or AIDS. And this is the most severe of the HIV infection stages. So again, if HIV is not treated, it can lead to AIDS. And basically what that means is that people have such badly damaged immune systems because of HIV virus that they can get an increasing number of severe illnesses, or what we call opportunistic infections. So people receive an AIDS diagnosis when their CD4 cell count drops below 200 cells, or if they develop certain opportunistic infections. And basically, our immune system is always sort of fighting pathogens. And when the immune system gets really weak, as what happens with AIDS, we're not able to fight off those opportunistic infections. And people with AIDS can have really high viral loads and therefore are much likely to transmit HIV to others. And, I think it's important to note that without treatment, people with AIDS typically survive about 3 years. But again, over the last 40 years, we've come a long way with treatments, and people can live, a long and healthy life with HIV and never progress to AIDS, and that's why HIV is just another chronic illness like diabetes and hypertension. And, several new studies have shown that if a person living with HIV is taking their medication and they've been virally suppressed, that means when you take blood from them, you can't detect any blood or any virus in their blood. They can't transmit HIV to their sexual partner. So I think that that's really, really an important point too.
Wow, thank you for breaking that down in a way that's easy to understand, because I feel like most people don't really understand. So thank you for breaking that down. I'm curious, what are some early signs of HIV and what types of predisposers would you recommend paying attention to?
Yeah, well, I think what's really critical for us to consider is that really the only way to know for sure whether you have HIV is to get tested. Knowing your status is huge because it helps you make healthy decisions for yourself and prevents you from transmitting it to people that you love. And so, as I was saying before, in acute HIV infection, that sort of 2 to 4 weeks after a person comes in contact with HIV and HIV is now in their system, they can have symptoms, but you might not necessarily have symptoms. And if you do have symptoms, you will have flu-like symptoms. So fever, chills, night sweats, rashes, muscle aches, sore throat, fatigue, maybe swollen lymph nodes, mouth ulcers. But the important thing to note about these symptoms is that these symptoms don't mean that you have HIV. Other illnesses can have these same symptoms. So if I was living in my perfect world, everyone, when they went to the doctor to get their blood drawn, to test your heartbeat, to look at your pulse, would get an HIV test as well, because we're in the middle of a pandemic. I've been working on pandemics my entire life, the first one being HIV, which we're still in, and now with COVID. And the only way to really combat that is to ensure that people know their status and that they're not transmitting to other people. And symptoms are not a good way to know if you have been exposed to HIV or not, because most people will have no symptoms.
Yeah, no, I think that is very helpful information. I'm also thinking about, sorry, I'm having a brain fart. So I'll come back. It'll come back to me. It's not coming back right now, but it'll come back.
I'm sure it'll come back eventually. I want to continue and just ask you, we cater to Black women in this podcast, and ask, why are there disparities in Black women being infected with HIV versus non-Black women?
Yeah, well, can I first answer that question by talking about what those disparities are? So we really know the impact of HIV on Black women, and then I'll try to break it down in terms of why we are at greater risk and why we see these like disproportionate numbers. So the most recent data we have in the United States is from the year 2018. And if you look at 2018, there were 1,173,900 people in the United States living with HIV. And of those, 261,800 were women. In that same year, there were 37,968 new HIV diagnoses in the United States in dependent areas. Of those, 19%, or 7,190, were women. 42% of those women who tested HIV positive in 2018 were Black women. So over 16,000 Black women tested positive the last time we have data available to this. 85% of those new cases in women were the result of heterosexual contact, and 15% were the result of infectious drug use, and then 1% is unknown or other, they're not really sure. So, and I think what's really critical to note is that for every 100 people that are living with HIV, about 86 of them don't know their status, and for every 100 women, about 90 know their status. So, there are a lot of people who are living with HIV who do not know their status. And what we know to be true about HIV is that you're much more likely to transmit HIV to other people if you don't know your status. And there are more people of color living with HIV who don't know their status. So that puts us at risk for transmitting. That's one thing. The other thing is that, people of color, because of centuries-long housing and economic discrimination, find ourselves more disproportionately in situations where there are high poverty rates, unemployment is an issue, lack of insurance is an issue. And one of the things that Gregorio Millet, who was the first person to run the US HIV strategy under the Obama administration, when Obama finally made a US strategy, pointed out that if you look at the counties in the United States that are disproportionately African American, so they have the highest rates of African Americans in the United States. There are about 667 of these counties that are largely African American. 91% of those counties are in the southern US, and they are marked by high rates of poverty, high rates of unemployment, high rates of lack of insurance. And what goes hand in hand with that is also high rates of sexually transmitted infections, gonorrhea, syphilis, and chlamydia. And so when you have another sexually transmitted infection, basically this could create sort of sores or breaks in the skin that allow HIV to more easily enter your body. And so when you have, those high rates of underlying sexually transmitted infections, it sort of sets a perfect playing ground for HIV. And so why do we have these high rates of sexually transmitted infections in our communities? Well, if you look at, the centuries-long historical, social, and structural factors that differentially put us at risk, that decrease our likelihood to develop relationships with medical providers because of the way we're treated with medical providers, because of poor patient-provider relationships, because institutions have not made themselves trustworthy for people in our community. There's all that. And then there's also the reality that most people, regardless of your race, are more likely to have sex with or partner with someone who shares their race. That's not true all the time, but most of the time. And for Black people, we are more likely than any other race to partner and have sex with someone in our community. So let's look at a place like Seattle, which is where I am. Black people make up 6% of the population. So as a heterosexual Black woman, if I'm going to date a heterosexual Black man in my community, I have 3% of the population to choose from. If I am a homosexual Black male, I've got 1% of the population to choose from. So our sexual networks are small. We're a minority. We tend to date within our communities. Our sexual networks are small. So if a disease gets into our sexual network because of its small, compact situation, if someone doesn't know their status and brings it into our sexual network, it goes quicker through the sexual network. If someone isn't getting tested and delaying treatment and progressing towards HIV or towards AIDS, and then their viral load goes up, that comes into our network. If someone knows they're living with HIV, but isn't virally suppressed because they don't have access to their treatment, they don't have a good relationship with their provider, they've got other things going on that prevent them from taking their medication, all of this impacts the viral load in our community. And as the viral load goes up, with each subsequent partner, your risk of HIV goes up. And I think it's really critical to note that Black women aren't engaging in any more riskier behaviors than their white female counterparts. You could look at, Becky here at the UW campus. She could be having the same sexual behaviors, or maybe even having more partners than her Black counterpart. And she is at much lower risk because her sexual network is bigger, a lot bigger. And the viral load in her sexual network may not be as high because the rates in her community are not that high. You look at these numbers of Black people who are testing positive each year, and the number of people in our communities living with HIV, and people who don't know their status because of stigma, because of all this that I just mentioned before, just increases viral load. And I think that that's really critical. It's not what people do that put them at risk. It's the situation and the circumstances in which they're doing it that really creates the risk for people.
Ooh, oh my goodness. The way you just broke that down, like, it makes so much sense, right? Not even just about HIV, but like all STIs and STDs in general. Like, it makes so much sense. I've never heard it explained in that way. Like, that's wild. Oh my goodness.
Yeah, and we see the same thing for COVID. It's not just HIV. The reason we're at greater risk for COVID is the same things, because of where we work, because of how we, where we live in high density settings. We have to show up for work. We can't work from home more than any other groups. I mean, if you look at any infectious disease that's disproportionately impacting us, it's not because of our behaviors, it's because of the situations and circumstances that we find ourselves in. So it's not just sexually transmitted infections, unfortunately. And that's why I think we got to change. We got to flip the script and change things if we want, these disparities to end and not continue to persist as they have for many decades.
Yeah. No, I most definitely am hearing that. And I'm pretty sure that's what some of your research is probably, you know, trying to figure out and explore right now. Yeah, I'm most definitely interested in that information. Yeah, I'm sorry, I'm kind of went off a tangent, but I'm just thinking of like, does that mean that, you know, Black folks should explore outside more than, like, you know, it's like, does that mean we should be more around other ethnicities, other races? Like, do we, like, what, like, how do you even, I'm just trying to unpack it, like, what do you even do in this type of situation, you know?
Yeah, well, I think we protect ourselves, you know, you make sure that, you know what your partner is doing, that both of you are, you know, getting tested for HIV, that you're practicing safe sex. If you are monogamous, you know, agreeing that both of you are monogamous. If you're not monogamous, like talking about what that means and how you're going to protect your relationship from bringing things into the relationship that you don't want, you know, including sexually transmitted infections. I mean, it really is about, you know, being open and honest about our sexuality, something that we're not really, you know, taught to do for the most part. I definitely don't think it means like, I definitely don't want it to come across as, oh, we got to go outside of our race, because there are many people who are Black who are living with HIV and undetectable and therefore unable to transmit to others. There are many Black people who are not living with HIV, and there are many people who are, you know, very cognizant of wanting to protect themselves and their partners. You know, that is, we share that, you know, along with other races. So I definitely think that our small sexual networks place us at greater risk, but our small sexual networks also create opportunities for love and strength across our communities.
Yes, yeah, absolutely. Communication, talking about this stuff, knowing your status, being open and honest. I'm hearing all of that. So, I mean, as you know, this is a mental wellness podcast. And so you're doing so much work, you're researching. I mean, you have your hands, it sounds like, in a lot of different things. Like, how do you take care of yourself, especially during overwhelming times, or even with research? I'm sure it can be defeating, like finding out these numbers and stuff like that. How do you take care of yourself?
Well, I like to walk and walk in the woods in the forest. You can see my background. I like being out in nature. So I make sure every morning, regardless of whether it's raining or not, and it rains here every day now, that I go out for a walk. And I go, you know, I got my rain gear and I've got either my music on, or I'm listening to a podcast that makes me feel good and that, you know, is adding to my joy. So, you know, 3 miles a day, I go out and just walk. I also I have 2 young daughters, so I enjoy spending time with them and playing games. I love board games, so we play a lot of board games, and you know, just making sure that you have your family connection. You know, I have a sister who I'm very close with. She lives on the other side of the country, so I don't see her that much, but we check in every day, and, you know, make sure I share the good, the bad, and the ugly with everyone in my life, you know, who's close to me, to get it out so that I'm not keeping it in and like sitting on it and stewing on it, you know, because I think that can create a lot of, you know, mental health challenges for all of us when we keep the stuff inside. We don't let it out and share it with people who can help us work through it.
Yeah, as we wrap up, I wanted to we ask all of our guests some takeaways you might have for our listeners, and that can be literally anything that you want to have for them as a takeaway.
Yeah, well, you know, we as Black women are, you know, the backbone of this country. If you ask me, we are the light and the promise for this country. So we need to really make sure we take care of ourselves, and that we are protecting, you know, our mind and our body, and making sure that we're asking questions and people are being open and honest with us, you know. And I think you know, we have to protect ourselves in order to, you know, protect everyone around us. So I would just, you know, sort of leave everyone with that, you know, you are a bright and shining star, and ensuring that you keep your light shining.
Yes, thank you. And thank you for joining us today. We greatly appreciate all the information that you shared. I hope that, you know, our audience enjoys this as much as we did.
Thank you so much. I really appreciate being here.
Of course. I hope you all enjoyed this episode today. I feel like pairing this with Nikki's episode, which I think we're going to share her episode before this, so that we have a story and then we share some research. It's a nice pairing to hear, you know, two different sides, and for the way Dr. Michele broke things down that were easier to understand, because I feel like I was kind of confused about HIV versus AIDS. I feel like I've shared with y'all before, but I had an uncle who passed away from AIDS. But when I was first told about it, was HIV. So I've always been kind of confused, and I've tried to research it, and I've never understood what I was reading. So I'm thankful that she was able to break it down in a way that was easy to understand. And then to also break it down and, you know, how are people coming in contact with this? That was really cool, the way that she was able to explain it, because it helped me to understand other diseases also. So I'm overall thankful.
Yes, me too. Like, yeah, no, like to hear the research piece of it, and that she's actively doing this work, she's been doing it for years. Like, it's always good to get those like hardcore statistics and to hear about it in this way. So I'm glad that we got the research piece with the personal story piece. I'll share her article that's specific about Black women and HIV in the description, just so you all can kind of read up on that. And yeah, we hope that you enjoyed another episode of Black Women Healing Podcast, and we will be back next week.
So y'all, we have to shout out our friends over at Fiverr. We are officially a Fiverr affiliate, and I love Fiverr because you can literally go to them for any type of project you might want to work on, whether it be if you need a new logo, you need help with the resume, you need help with social media, they help you over there. So go ahead and check out our friends over at Fiverr. That's 5ERR. So 5 with 2 R's at the end. So go ahead and check them out with the link in our bio and tell them that we sent you.